Welcome back, everyone, to NeuroAlchemy, the brain body healing podcast, where science meets soul and healing is understood as a multidimensional journey. I'm your host, Dr. Sarah Young. On this show, we explore the intersection of neuroscience, nervous system regulation, environmental health, and human resilience. We slow our conversations down and we define our terms clearly. And we look for those deeper patterns behind healing because clarity creates safety, and safety opens the door to meaningful change. Today's conversation is something that affects millions of people, including me, yet it's still deeply misunderstood. Brain injury recovery. I'm joined today by Scott. I don't know how to say your last name correctly. Is it
Bukow.
Bukow? Bukow. Thank you, Scott. Scott Bukow, who has been researching what he believes are several overlooked mechanisms involved in traumatic brain injury recovery. He points to fascinating overlaps between traumatic brain injury, also known as TBI, and long haul COVID, suggesting that many people may be experiencing similar dysfunction patterns without realizing that connection. Scott, we're so glad you're here. Welcome to NeuroAlchemy.
Thank you for having me.
Before we begin, I always like to start with just a moment of arrival. How are you arriving today? How has your day been going, either energetically, mentally, emotionally, physically, whatever you got?
Well, I'm always excited to share science with people because the more people know, and my mission is to change the standard of care. So I'm excited to be with you. And I'm a big surfer, so I still get out, and the weekend's coming. So it's beautiful weather here, and looking forward to being in the water.
Where are you calling from?
San Clemente, California.
I love California. That's my favorite state, if you want to know. Thank you so much for sharing that. There's no perfect way to show up here, everyone. As you know, I like to say, however you're showing up today is enough. Scott, I'm so excited about this conversation. In case you didn't know, I'm a brain injury survivor myself.
I did not know that.
Yeah, I was told that I wouldn't be able to recover, so I went to get a PhD in integrative and natural medicine to figure out how to fix my brain. So I am right there beside you, leading the charge. There is a better way. There's so much that we're going to uncover in our conversation today. There's so much great things I want to share with people out there because so many people, they're suffering from traumatic brain injury and they feel like there's no way that they can get better. And it's just simply, in my experience, it's not the whole story. Many people assume that brain injury recovery is just about time and rehab, but you've said there's several missing pieces that aren't always discussed. Can you start by explaining what led you to that realization?
Okay, yeah. So I was the global trainer for the Institute for Functional Medicine in 24 countries. So I would, for doctors and practitioners that wanted to get certified, I would do all the training and did that for almost 2 decades. And I had gotten home very late one night from a trip, and I had redone my house in stone, the stairs and the floor, and the stairs were done with some sharp edges, and they had just put sealer on it, and I slipped, fell down the flight of stairs, fractured my skull in 3 places, woke up 3 months later after surgery and being in a coma for a couple months, and, I was not me any longer and lost my family, my house, everything. It was insane, and it was a living hell, and, the standard of care wasn't working, and at the time, they were just starting to understand functional neurology, and through some colleagues and my own understanding, I came back and made a full recovery. And so I made it my life's mission to solely look at brain injuries and figure out why up to 50% of people are still suffering the same, worse, or past after 5 years.
Absolutely. I mean, yes, this topic is so deeply personal for me as well. After my own brain injury, I noticed that many people were being told the same thing. Your scans look fine. We don't see anything wrong. And yet, inside of us, in our daily experience, we knew a completely different story for ourselves, right? There were cognitive changes, there were energy crashes, there was sensory overwhelm, memory disruptions, and that disconnect between the clinical imaging and the lived experiences is one of the reasons I pursued my doctorate. And that was in integrative medicine. My dissertation was quantum integrative medicine and brain injury. And that was the
Wow.
same book that I wrote on the same topic. So I think you and I really understand each other very well. What patterns were you seeing that made you realize that something important was being overlooked?
Well, the standard of care, if you look up the Cleveland Clinic, it's, NSAIDs, you know, uh, rest, pain medication, antidepressants, anxiety medication, stimulants. They're, treating symptoms, not rebuilding the brain. Then you have like some great therapies out there, physical therapy, cognitive behavioral, and some of the functional neurologists that are doing hyperbaric and TMS. And these are all great external modalities. But what I discovered were that there are five specific dysfunctions that are all well established in the literature, but have been overlooked and never connected until now. And that's kind of what led me along the path. And then as I discovered these dysfunctions and started treating patients, I was able to work with different compounds. So not just using the science, but seeing firsthand what worked the best until I came to what I guess you would call the perfect recipe to address these five dysfunctions.
One of the most interesting ideas you raise is that TBI or traumatic brain injury and long haul COVID share very similar dysfunction patterns. For listeners that are hearing that for the very first time, can you explain a little bit more about what those overlaps look like?
So, when a brain injury occurs, some instantaneous things that happen, like a breach to the blood-brain barrier, a leaky brain. Like everyone knows the term leaky gut. You get a leaky brain. The brain's immune system goes into overdrive, and it actually becomes hypersensitive for not just months but years. And then, as you started to realize, or when neurologists started to look more at long hauler COVID, they realized that they were suffering a lot of neuroinflammation. So, neuroinflammation and the brain's immune system causing neuroinflammation, I separate them because there are other root causes of this inflammation. And that's why we need to address what are the other things causing this inflammation. So, when the brain is inflamed, it can break down the blood brain barrier. It doesn't take a TBI for that to occur. When that happens, the body's immune system gets in to the brain, which it shouldn't, and it doesn't recognize things and it starts to attack almost like an autoimmune like condition. With a TBI, substances are released like guess what? That gets coded in the body as a virus, antibodies are formed, and so they get back through a breached blood brain barrier and start to destroy the brain cells that produced it in the first place. So now you've got the brain's immune system causing inflammation. You've got the body's immune system and these antibodies. And now we're just at a couple of the reasons. And all of that inflammation in the brain is sending signals down to the gut. And there are rapid shifts in healthy bacteria levels. And this is all well established. And dysbiosis occurs. That in turn causes more and different inflammation signals back up to the brain, and we get this bidirectional inflammatory loop we need to knock out. So we need to heal and seal the brain and heal and seal the gut. When you look at drugs that are used for inflammation, two things. One, they don't address all the different cytokines. So, what is a cytokine? Which I know you know, but I'll break it down in a military term. So, they're different things that are attacking you. So, in the military, you might have a tank, a submarine, a fighter jet, and ground forces. Well, an anti-inflammatory may only address one of those, but the real problem is they cause gastric bleeding, which will exacerbate the condition. and actually cause more of this inflammation to occur. Then the brain sits in a fixed volume. So as this immune activation is occurring and more inflammation is causing swelling, that swelling in a fixed volume starts to crush these tiny blood vessels, which then starves oxygen and blood to other parts of the brain, and you get a secondary ischemia, a new wave of cell death. So you have all of these problems going on that are causing a tremendous amount of inflammation. And I kind of use an example like if you open a computer and you pour lighter fluid on it, light it on fire, and then close it back up, how do you expect it to work? And your brain's on fire, your gut's on fire. Then there's the microvascular network, which is 400 miles long, that gets damaged. And with TBI patients and with COVID, there's clogging that's involved. And specifically with brain injuries, they start to get calcium deposition in the capillaries, which then blocks blood, oxygen, and nutrients being delivered. So the idea in functional medicine is to put the compounds in place that address these dysfunctions and then at the same time rebuild new brain cells, heal damaged brain cells, remyelinate axons, rebuild them, and really rebuild where drugs are stopping something or killing something off, where functional medicine wants to look at the root cause, find the different things that are causing this, and get the body the compounds that it would normally get in a perfect diet. Unfortunately, and you mentioned environment, we're exposed to way more toxins than we ever have been in the past. Our food is processed, our soils are depleted, and the brain is the most susceptible of every part of our body to oxidative stress. So when we do all of those, I came back and I started seeing patients with a decade or longer that had tried everything else coming back: vision restoration, able to walk again, memory, anxiety, anger, brain fog dissipating, and then and coming back to themselves. So I ended up putting what I was using 14 bottles into a medical nutrition kit that was a lot easier to implement and use.
So I just want to go back and mention what I said earlier, which is how many people have experienced this that have had brain injuries where they feel like something's not right and something's off and they're being told that their scans are looking fine. I just want to reiterate that everything he just describes, inflammation, immune signaling, that mitochondrial function, nervous system regulation, none of that stuff is going to show up on scans.
No,
What's
it doesn't.
Right? But it's like, come on, we gotta look at the whole picture, not just a tiny little part of it, right?
Yeah, even people, when you go to scans, let's just take the microvascular network, for example. And if you were to go to get a scan to see if you have calcification in your arteries for heart health, by the time that scan can pick it up, you've already had too much calcification in the arteries. Now, in the brain, they're capillary, so they're even tinier and smaller. So a scan would never pick that up.
What's fascinating here is that we're beginning to see this broader pattern emerge, right, across these neurological conditions. When the brain experiences injury, whether it's infection or injury itself or toxic stress, even that downstream effect, they look surprisingly similar. Neuroinflammation, energy dysregulation, autonomic imbalance, and sometimes what people are experiencing isn't permanent structural damages, even though they think that it might be. It's a system that's lost its ability to regulate. Scott, do you think that shift in perspective will change how we approach recovery?
So that you bring up a really important topic. In the 19th century, up to 20% of women were dying after giving childbirth. And this Dr. Semmelweis figured out that it was that physicians were not washing their hands. It took the medical community 30 years to make that change. because they didn't think, it wasn't a drug. It had to be something, some crazy disease. In today's world, even new science takes about 15 years to get into the standard of care. So what I'm trying to do is to get patients to start asking their doctors questions. What are you doing about my blood brain barrier? What are you doing about my brain's immune system? How are you addressing my microvascular network? What about my gut brain axis? Are you helping restore new neurons? Are you restoring damaged neurons? What are you doing? And they won't have the answer. And when they don't have the answer, then they feel caught. So then they will go and research. And that's how we'll get the movement. The more people start asking the questions to their practitioners, to their doctors.
It's so true that knowledge is power, right?
It really is. And so many people are told this is your new normal. And I'm on a lot of TBI Facebook groups, just to answer questions. And it's heartbreaking because so many people are, told this is how you're going to be. The literature says that there is no real recovery from a TB, and people start to believe that, and they get stuck in that mode. And sometimes I almost think that they get stuck thinking that that's how they are, and they get closed off as well, just like the doctors. And it's like, wait, no, there are possibilities. People can come back. Maybe not always 100%, but I have not had one patient in 4 countries without significant life-altering changes to where they feel like themselves again. And so I feel like, if we could start doing that and get this science out to other doctors and practitioners, and patients can feel that there is hope out there and there is new science, then they'll be excited. And, what we think is what we believe.
I agree, absolutely agree. Another concept that often comes up in neurological recovery conversations is the gut brain axis. Can we slow that down a little bit in case there's some people out there that they don't know what the GBA is?
Sure. So the brain and the gut are like two teenagers that are madly in love and they're texting each other all day long. They're constantly communicating. They just can't get enough of each other. So, and if one has a problem, the other one has a problem. So, if the brain's on fire, the gut's on fire, and vice versa. That you really, I mean, people. It's well established now. A lot of people that have leaky gut and dysbiosis end up with a leaky brain and neuroinflammation without having a TBI or COVID, just from dysbiosis. So the gut and brain are just so connected and communicating more ways than we ever thought, and we're still learning. I mean, I think we're at the tip of the iceberg in terms of what's out there, but at least now it's become people are aware of it, and there's even a new term now that's called GBD, gut brain disorder.
Many people don't realize that communication between their gut and their brain is happening through immune signaling, through microbial metabolites, through the vagus nerve, and through their inflammatory pathways. They just think their gut's their gut, their brain's their brain. They don't have anything to do with one or the other. So I love that you and I both are like we have a metaphorical megaphone, right, on the world. And we're like, hey man, there's another way. There's more to see. Open your mind just a little
Yes.
bit, right?
Yeah, and it's important too to know this, that, in terms of depression and anxiety, a lot of our feel good brain chemicals are produced in the gut. Serotonin, GABA, neuroepinephrine, all dopamine, all, produced in the gut, or at least a percentage of it. I mean, up to 75% of serotonin it's produced in the gut, up to I think 50 dopamine. And so you just get somebody's gut better and they emotionally feel better. And that's well established, that when somebody has dysbiosis and irregularities with their GI issues, it changes their behavior and mood. So it's phenomenal, again, the gut and brain, what goes on.
Individually, we are powerful pharmacies, are we not?
Yes, we
Always
are.
generating chemicals and hormones and all the things that people don't think about. And if you don't know about why would you think about it? You just exist, right? You just go about your life.
Yeah, and it's why I named my practice my brain mechanic, because it was like, okay, we just need to put the pieces back that the car or our body, brain have lost or are broken, and just replace them. And those nutrients sometimes are very challenging to get from a diet, or we need, a little extra burst of them, and then we're able to make, massive changes and rebuild the body and brain the way that it was designed.
This is one of the areas where integrative medicine and neuroscience are beginning to overlap more and more in very interesting ways. For decades, the gut was viewed just as a digestive organ, right? But now
Yeah.
we understand that the gut is also deeply evolved in immune regulation, neurotransmitter production, and inflammatory signaling, which means that disruptions can have profound effects. Tell me a little bit about how that relationship affects people recovering from brain injury.
Well, when you address these dysfunctions, I'll start with this. In 2018, the head of the Department of Psychiatry at the University of Wisconsin said he found himself amazed that neuroinflammation was the sine qua non of all mental illness, far being it from obsessive compulsive disorder to schizophrenia. It was neuroinflammation. New Science Direct came out with an article. Psychiatric medicine hasn't changed much since this disease. Could blocking the effects of neuroinflammation be the next step change we need? So we know the brain's the most susceptible to oxidative stress. You've got gut and dysbiosis in the gut. You're causing inflammation in the brain. If the gut's on fire, the brain's on fire. And the brain's on fire, the gut's on fire. So that's why when you address both, you get massive changes in not just emotional well being, but cognitive abilities.
And I know that you mentioned this earlier, but I definitely can relate very deeply, and it's not talked about enough in brain injury recovery. And it's the identity shift that you mentioned, how you were like, I wasn't me anymore. Like, knock, knock, who's there? And you don't recognize the person that you are now. And people don't talk about that enough. When someone
No,
experiences those changes, they feel like a different version of themselves. I don't know about you, but I felt it to be incredibly disorienting. So, what have you seen in terms of how people psychologically navigate that transition?
so I saw a post last night that said, "What if woke up and you were no longer yourself?" That's a brain injury, and it's and I find, I have a YouTube channel as well, and I've asked a lot of patients because I don't get a lot of comments on it, and they're scared. They said, "No, we're scared to talk about it because people don't understand it." And even to this day, when I talk to people, they're like, "Well, do you still have problems?" And I'm like, "No, I'm recovered." But, there's this stigma, like I had a brain injury, so there's something wrong with you. And people are a little bit afraid to talk about it. And another guy had a picture of him in the hospital, and he's got the bandages and everything all over him. And he said, and then a picture of him now where he looks just fine, and, he's put together, and he said, "It's almost worse now because people I still feel the same way as I did back then." And, people could see the injuries with the bandages and in the hospital and the IV tubes and everything, but I'm a mess inside, but I look normal on the outside. And one particular thing that happens with TBI patients is they get anger issues or emotional outbursts because there's a lot of excitatory transmission trying to go on. I mean, the brain's trying to fire, I should say. The brain's trying to make all these signals with this fire going on. And again, it's not really you. And so these emotional outbursts happen and people don't understand it. Even the caregivers I deal with, I have as well veterans or military that have come back and they've had brain injuries and their spouse has left them or they've lost a loved one because they're struggling because their brain's being attacked. And so people need to, I think, talk more about it. We need to be more compassionate as a society, and the medical community needs to really look at integrative medicine. I don't believe in any neurologic condition we can make real significant changes unless we combine Western and functional medicine. There will never be one pill for this ill, as well as a lot of other conditions and COVID long haulers. You have the same types of things. They're the same dysfunctions that we just talked about with brain injuries. And so they're going through some of the same challenges as well.
Yeah, I like to remind people that healing isn't always just biological, right? It's emotional, it's relational, and many times it's also existential. A brain injury doesn't just change their cognition, it changes how someone experiences the world itself. And sometimes the healing process involves learning to rebuild trust in your own body and in your own nervous system again.
Yeah, and trust the process. So when you have somebody that, like yourself or whoever, that understands how to, work with a brain injury, there is a process. Drugs, people tend, and we're in a very rapid society now, instantaneous results. And, it takes a few months to rebuild a brain and the gut and the microvascular system and to produce new neurons and to have neuroplasticity where one neuron connects to the next neuron take place. It takes a little while, but trusting the process and believing in the science that's out there. I mean, we've just been told for so long that there's no answer for these, and people get that stuck in their head. And you're right. Our emotional thinking changes us dramatically. I mean, look at just waking up in the morning and doing a gratitude list, what that does for you. And they've talked about, and the Bible said that 2,000 years ago, and, they're pretty right.
Many people living with neurological symptoms are told that the recovery will plateau and that improvement has limits and there's nothing that they can do. After that, I think you and I were both probably some of those people. But what message would you want to tell someone listening today if they've been told that their brain can't improve, that they can't make any more growth? What do you think about that?
Absolutely false. I've seen it firsthand. I I should I should have been a vegetable. I mean, I suffered a severe DAI. I was not just a moderate TBI, I was a severe TBI, and I've watched it with patient after patient after patient. I have patient testimonials. So if you're told that, it's false. The science is there. It's not just me as this one individual saying it. The science is out there. You can build new neurons. They finally, this year, 2025, neuroscientists were still debating whether the human brain could make new brain cells. They finally put that to rest, 2025. And we've known that there's compounds out there that have, decades of safety, efficacy, and science to build new neurons, heal damaged new neurons, and recreate neuroplasticity. So if somebody hears that, know that there are answers now and that the science is there. It's just that the medical community hasn't yet. Again, it takes them 15 years on average to implement that into the standard of care. So all this great science comes out, but it takes them a while. So if you hear that, find people that can answer those questions. And the five dysfunctions, and I'll send them to you, and you probably already know them. Ask your doctor what they're doing about them, and if they can't answer that question, then obviously there's an answer. So if a doctor can't tell you how he's going to rebuild your blood-brain barrier, and we know like choline, for example, found in eggs. In 2013, stroke victims, they were able to rebuild the blood-brain barrier with choline. Not a drug, natural substance, but it works.
One of the most powerful ideas in modern neuroscience is that neuroplasticity, which is the brain's ability to reorganize itself. But plasticity doesn't happen in isolation. It happens in response to our environment, our nourishment, our safety, and our stimulation, which means that sometimes recovery isn't about fixing a broken brain, but it's about restoring the conditions that allow the brain to adapt again.
Yeah, you think of your brain as a giant map, and if you took all the roads of the US and you bombed them and, they got blocked and the different highways and freeways got blocked off or damaged or weren't connecting any longer, that's, a brain injury or COVID long haulers from all this neuroinflammation. You put that back together and you make new highways and new freeways that have better ways of getting there or a better map that gets you to a destination so you can rebuild those connections in new ways that help you think in new ways and react in new ways. Just as I was saying, gratitude, just being grateful changes your neural pathways. And that's neuroplasticity happening. But you need the compounds to allow that to happen. But then emotionally in yourself and in your brain, you have to believe it and practice it.
Absolutely. So I like to ask you if you had a tiny little practice that, not a major protocol, but something that somebody new, maybe they're doubtful, Scott, they don't believe us. Um, but you want to give them, like, here, try this over the next week every day. And so they can track it and see how they shift. What would you recommend for that?
You wrote that, and I thought I actually gave this a lot of thought because, one thing could be like, well, work on things that involve physical activity, mental stimulation. We've got AI now and Chat GPT. Start asking questions, and for a week, go into the science. If people don't believe what we're saying, ask Chat GPT, and it will tell you the same things. I saved articles for decades, and, the way it's frustrating but great. And I asked ChatGPT the question. I said, "Does a brain injury become an autoimmune disease?" And it came up with the exact same postulates that I took me almost a decade to put together, but that science is there. So I would spend a week looking at the science and, can the blood brain barrier be repaired? Is the brain's immune system really hypersensitive for years, not just months? Is the gut brain axis really a true thing? Is it, connecting? And if a dysbiosis occurs, can that change my emotional behavior? Ask those questions. You've got AI models now that will answer it in seconds. And then that can give you the hope that there's change. So that's one thing that I think just and ask your doctor. On a physical or mental level, anything that you're doing that's physical, if you have the ability to do that and it involves mental um, challenges. So if there's a hobby that you do and you're trying to improve, so surfing, like maybe there's a maneuver I'm trying and I've got to think about it and keep working it and doing it over and over again. And that's how you remap and get new neuronal connections going. I have patients that have, here's a great example, patients that have speech problems. I tell them, start singing your favorite song, play your favorite song every day and start trying to sing the words to it. And it's amazing when you do that and you start fixing the other parts that they start to be able to do that again because they're listening to a song they love and their brain's focused on it and they're trying to get the words because they love that song so much. So find what you love and put your brain to use becoming better at what you love doing.
And I'll just share a little bit of my own because this is so near and dear to me in my journey too, Scott. Like when I think about what did it really take, like for me to be sitting in front of you as well as I am today? It wasn't just one thing. I had to dramatically change the way that I treated my body from the things that I put in it to the amount of water that I drink, right? I am like a drill sergeant when it comes to my sleep. I have to have a certain amount of sleep. If I don't, I'm a very different person the very next day. And I make sure I get a lot of blood flow to my brain, so I do a lot of exercise. What I didn't tell you yet is that before that last brain injury, which was my seventh, I was a medical speech pathologist working in the hospital. And then after that brain injury, I wasn't able to find my words or communicate or remember or problem solve all the things that I was before that moment training other people how to do. I
Yeah.
suddenly wasn't able to do and had to rebuild all of that myself. And memory was not something that just came back. Even in my PhD program, some of those initial courses in the very beginning, I had to take 3 or 4 times because I was rebuilding those memory pathways. And even to this day, 6 years out from when that accident occurred, I do continue those neuroplasticity practices you were just mentioning. So I always do something that are called 20-minute blocks. And all of the patients and clients I've worked with over the years are very familiar with this. But I say take 20 minutes. And if you can do this 3 times a day, that's even better. Find something novel and new. Maybe that's Duolingo with some language that you knew in high school but forgot about. Maybe that's playing a new musical instrument. Mine's the handpan. That's what I'm mastering right now for one of my 20-minute blocks. But maybe it's a new sport. Like, I don't know what yours is. I don't know what your thing is. But if you work on that consistently enough and you do enough persistence and repetition, then you're going to start rebuilding those pathways that we're talking about, but not without you addressing the other stuff, right, Scott? We've got
Yeah,
to address
so
the gut and the nutrition. Tell us more.
yeah, so you said it so well. A brain injury is a multifactorial condition. What I've come up with is the missing pieces to the puzzle, but we still need to do all of those other things. The physical therapy, the cognitive rehabilitation, the speech therapy, like you were saying. I mean, I that's great. I'm gonna take your advice on using that with patients, a 20-minute block. I mean, it takes multiple things to rebuild the gut and the brain, dietary changes. A lot of people, well, so hard to do dietary changes. Well, a simple thing is stay on the perimeter of the supermarket and you're pretty safe, and eat organic. And, as you go more inwards in the supermarket, the worse the food gets. Stop eating the fast foods. Try a new sport, a new hobby, and integrate your brain and physical. So there are great other modalities out there. You have to work on yourself and as you were saying, practice different things for getting those neural pathways. And then I've just discovered the compounds that help rebuild those parts, the microvascular network, shifting the brain's immune system from pro to anti-inflammatory, healing the gut and sealing the gut so we stop those signals from happening, and then putting in the compounds that rebuild neurons and axons and remyelination. And, people can come back, and I'll just say it one last time, research it. There's so much availability now to just go on to AI and ask these questions and know answers, and get people out of that mode of like, "This is my new normal, I'm not gonna change." And, you know, there's some great TBI groups, but I I've listened to them and they've
Be careful
almost.
with those because they can get negative too.
Exactly, and and
Yeah.
and I sat in on one, and it was all negative, and, like,
Hmm.
this is, and it's almost like they become, like, this is their.
Cotton in the ears. They can only
Yeah,
hear what they can hear. Yeah. I've
yeah,
seen that too. Yeah.
yeah, and I was just amazed at it was just a bunch of negative, negative, negative. And I'm like, oh my gosh, no, this is not right. And like yourself, I do things every day. Exercise increases blood flow. There are compounds that increase blood flow, but we want to do it via enos, endothelial nitric oxide, not inos, inflammatory nitric oxide, which a lot of compounds cause inflammation that build blood flow. So, we can do all of these things, but it takes not just, there's not one solution.
Amen. I say that all the time, that it's more like a puzzle with a million three-dimensional pieces, and nobody has the same three-dimensional pieces. Everyone's just a little bit different. We're kind of more like a kaleidoscope, right, than a cookie cutter.
Yeah, I humbly feel I found the missing pieces to that puzzle. And then if you do all of those other things, I mean, I've seen it so many times. I have a patient that, now with physical therapy, she was in a wheelchair. She's was walking with a walker. She was able to walk again. Now she's walking without a walker. Another patient that you had to talk to her so she could identify who you were. She can read a book now. People that just say, thank you, I'm myself again. And that's the big one. And I think unless you've had a brain injury, it's indescribable to another human what it's like up here, what's going on, and to come back to yourself again. And it's possible. And the science is there and it shows it.
And I also wanna tell everyone that, yeah, we've mentioned like a million things and like that might be overwhelming, but please don't underestimate the power of small, tiny changes. Like avocado toast. I'm gonna have a healthy fat with breakfast, and that's what I'm gonna do until I do it consistently enough to also add some blueberries that give me those antioxidants. For example, right? So don't try to like take everything that we're talking about and be like, "Oh, I'm doing everything wrong and I need to replace it." That won't work. You'll fail. Your inner child, your consciousness will be like, "That's too much. I give up." So pick one small simple shift, one small thing that you can work with, something tangible, and wait till you feel good about it consistently. Scott, if there's one thing that you hope our listeners will take with them as they walk away from hearing our conversation today, what might that be?
That COVID and TBI, there are 5 well-established dysfunctions in the literature. They have been overlooked and never connected until now. They need to be addressed simultaneously because it's like a domino effect. One goes out, then the others fall into line. And so there is an answer, and we'll take all of the other wonderful things out there and make them more successful and longer lasting. And believe I dedicated my life to figuring this out. I do free consults on Thursdays. Uh, and sometimes I just talk to people and say, you know what? You don't need me. You're okay. You just need to make some dietary changes. Other people, I say certain things or direct them to the right person. But there's people out there that really care, and most people in functional medicine, when you meet us, we have had something horrible happen to us in our lives. And that's what drove us to find solutions because we experienced it. And so there's a lot of compassion out there. A lot of doctors are not the most compassionate people. Functional medicine tends to be a little different. And I think a lot of us have had something significant happened in our lives that made us want to go out and make a change in healthcare. And those people exist. They're out there, and find them and don't get caught. And I love that you said be careful of getting caught like in the small groups, the negative feedback, and get yourself out of that. I love that you said that. And I also love that you said don't try to take everything on at one time. I created a medical nutrition kit so it's really easy to take because I had 14 bottles before. It was too much for people. When you're doing those things, a 20-minute, period of time increments and day by day. You just get through each day, and before you know it, you're going through a forest and you're chopping down a tree each day, and before you know it, you'll be through that forest and you'll see the light and everything will be different.
It's so funny that you said it like that because that's often how I describe neuroplasticity. Like you have a house on one side and a river on the other, and there's a huge field of grass, and you've never been through the grass before. So the first time you take the path, but it's not worn yet. So if you try to go back a second time, it's not worn down enough for you to follow the same path. But if you were to take that path every day all summer long, then the next time you went to go find that path, you could follow it, right? And neuroplasticity is a lot like that, and so is recovery. Scott, thank you so much for sharing your work and your perspective with us today. And to our listeners out there, thank you for being here. If today's conversation resonated with you, please consider sharing this episode so these ideas can reach the people who need to hear them the most. You can learn more about our work in the show notes. Until next time, remember that healing is rarely linear. The brain is adaptable, and sometimes the path forward appears when we begin connecting the pieces that were previously overlooked. This is NeuroAlchemy, and you are becoming. Thank you. Bye for now.